Member for Orléans.
Thank you very much, Mr. Speaker. My question is for the Minister of Health. Ottawa's Chief Medical Officer has declared that our city is in a second wave of COVID-19. Case counts that we haven't seen for months, and a testing strategy so flawed that people stand in line for hours before the centres open. A line 1 kilometre long on Moody Drive last week, Mr. Speaker. 11 new tragic deaths at the West End Villa long-term care facility, and now an elementary school, the first in the province, is going to be closed for 2 weeks because of extensive COVID-19 exposure. The government is sitting on billions in federal COVID-19 assistance, and they've promised for months that they have a fall second wave plan. Fall begins tomorrow. The second wave is here. Where is the plan?
Minister of Health.
Well, thank you. I thank the member very much for the question. We have already taken action with respect to some of the long lineups in Ottawa, as I indicated earlier, that we have increased capacity by extending the hours of a number of the assessment centres. There are 41 assessment centres in the entire East region. Total daily average visits, 5,100 people. We've already taken action by having those assessment centres expand their hours of service. And we also have some mobile testing services that are available in pop-up centres in those areas where the greatest lineups are occurring. We're also looking at bringing others on. We are looking at expanding capacity by having other organizations provide service. That is being taken care of. With respect to the advent of a second wave, we have prepared for a second wave. We have a plan that is about to be released. It's going to be released immediately, but that doesn't mean we're not already implementing parts of the plan. We will be discussing that with the members of the public, but the plan is being implemented as we speak.
Thank you very much. And a supplementary question.
Thank you, Mr. Speaker. My supplementary is also for the Minister. If the government has a plan for a second wave of COVID-19, how does the Premier roll into Ottawa last week and immediately contradict the Chief Medical Officer of Health on who needs a COVID-19 test? If they don't have a plan to improve physical distancing in schools, we know this for a fact because they voted against it last week. The iron ring around long-term care has crumbled, and despite what we've heard earlier from the Minister of Long-Term Care, I want to quote an employee at the West End Villa. Workers are going from room to room, working with these residents, caring for them, and they do not have the proper N95 masks to use. The Financial Accountability Officer has confirmed that the government has only contributed 3 cents on the dollar for COVID-19 supports, yet there remains billions in federal dollars available to the government in their accounts, Mr. Speaker. We've known that a fall second wave is coming.
Question.
Where is the plan, and why won't they show it to Ontarians?
Minister of Health.
Thank you. Well, as I indicated earlier, there is a plan. It is being implemented, and it is going to be released immediately. But it does address all of the issues that you have referred to. Our government is putting hundreds of millions of dollars into protecting Ontarians' health and well-being. And we have been in discussions with the federal government with respect to the monies that are available to us for expanding our testing and lab facilities, for contact tracing, and for mental health facilities. All of these options are being developed. They are ready to go. They are in our plan. They are being brought forward. We have already substantially increased our testing capacity, which was at 25,000. We're now at easily 35,000 and close to 40,000. We will be at 50,000 available tests in a very short order. So we are fulfilling our plan. We are increasing our testing and our lab capacity. We are ready for the fall and everything else that will bring with it, including the flu, and making sure we can continue with the surgeries and procedures that were postponed.
Thank you very much.